Listen this week to KSL News Radio, Utah's all-day companion for news. Missing teeth and dentures come with all kinds of inconveniences. There's the glue, the glass by the side of your bed, along with a lifetime supply of Effordent, and an occasional embarrassing moment that you really don't need. All that can be fixed in one day. At Stubbs Dental, in one day, you can toss your dentures and have a full set of functioning, permanent teeth that will take your life and your smile to a whole new place. What a great way to take a bite out of life without the worry. Stubbs Dental is Utah's leader in implant dentistry with an expert team of doctors and oral surgeons. Right now, get 20% off your same-day smile or all-on-4 procedure and a complimentary, no-obligation consultation. Stubbs Dental will change your life permanently. To find out more about your same-day smile or all-on-4 procedure and locations, visit stubbsdental.com or call 385-337-4936. That's 385-337-4936.
Mary's Bistro delivery business is bustling and ready to burst.
Orders 34, 35, and 36 are up. Who's handling these? Hello, Mary's Bistro, now delivering.
It's time to hire.
I need Indeed.
Indeed do. The moment you sponsor a job on Indeed, you get a short list of quality candidates from our resume database. Indeed delivers 2.5 times more hires than the other branded job sites combined, according to Breathe HR 2019. Visit Indeed.com/credit. $75 credit for your first job post. Terms and conditions apply.
This is Derek Overstreet of the New Millennium Group and host of Stop Working and Start Living Radio. If you're close to or in retirement and you don't have a tax plan, call us right now. 888-999-6370. That's 888-999-6370. Listen, our country's been spending like never before, and the tax bill is coming soon. If you need an income tax strategy and a financial plan that will get you through the rest of your life, give my team a call, 888-999-6370. That's 888-999-6370. If you want an investment plan that allows you to keep more of your gains and pay less taxes, give us a call, 888-999-6370. My team specializes in the type of plan that will get you retired 3 to 5 years sooner than you thought possible. So get a no-cost tax analysis by calling 888-999-6370. That's 888-999-6370. My team is standing by now.
When you need affordable healthcare for all ages and stages, lean on Molina Healthcare. Molina has 40 years of experience caring for moms, kids, and families across the U.S. Molina provides 24/7 virtual care, plan options with low copays, right quality network of providers and hospitals, mobile applications for mobile people, preventive care services, and more, all at no cost. For affordable, quality health care, choose Molina. Go to choosemolina.com for details and to see if you qualify.
Traffic and weather together brought to you by Mountain America's Visa Triple Rewards, and Ricky Meese is in the KSL Traffic Center.
Pretty quiet out on our roads, whether you're traveling the freeways or main secondaries, even the surface streets, no problems reported. We're also delay free. A heads up though, construction is going to be in place early tonight. Southbound I-15 will be reduced to one lane between 650 North and 700 South in Clearfield. It starts at 7 o'clock. It will continue until about 5 o'clock tomorrow morning. So just be aware you could run into some possible delays. Clean Cuts Trees, #1 for winter tree services in Kaysville. Serving Davis and Weber County, professional arborist, affordable prices. Call 801-473-7548. Clean Cuts Trees. Ricky Meese in the KSL Traffic Center.
And KSL weather expected high of 43 today. Air quality a mix of moderate and unhealthy for sensitive groups along the Wasatch Front. Overnight low around 20 degrees. It's 35 right now at KSL News Radio, 102.7 FM, 1160 AM and KSLNewsRadio.com. This is Utah's all-day companion news.
The vaccines. Hope on the horizon. In-depth coverage on KSL News Radio.
Good afternoon, everyone. I'm Amanda Dixon, and this is a special town hall, The Vaccines, Hope on the Horizon, sponsored by Cigna. And I'm delighted to welcome to the program for the first segment of this special town hall, Dr. Angela Dunn, who is the state epidemiologist. Dr. Dunn, welcome to the program.
Hi, happy to be here.
Thank you so much for your time. I know we're going to be talking about vaccines, and I do want to get to that, but may I start with asking you where we are right now? Are we experiencing the surge from Thanksgiving or from just the buildup that many had predicted?
What's really exciting is that we didn't experience the surge that we were all predicting from Thanksgiving. We were expecting to be in the 4, 5, 6,000 cases per day range, and we're in the 2,000s, which is fantastic. I think that goes just a long way to speak of the efforts Utahns put in that hard reset 2 weeks leading up to Thanksgiving. And then it shows that people adhered to social distancing and mask wearing during Thanksgiving. So it's certainly something we need to keep going through the December holidays.
Which leads me to ask you, we're hoping that we'll get that emergency approval, maybe even tomorrow. Is that right, from the FDA on the vaccine?
Yep, exactly. December 10th, tomorrow, we are expecting to hear from the FDA that they have approved the emergency use authorization for the Pfizer COVID vaccine.
Which means how soon then will the first Utahns be getting the actual vaccinations?
Yeah, so once the FDA approves it, it then goes to the ACIP, which is an immunizations advisory body to the Centers for Disease Control and Prevention. They will meet on either the 11th or 12th and put forth recommendations to the CDC about how to best use the Pfizer vaccine specifically. So they've already released recommendations on general use of COVID vaccine. These recommendations will be specific to the Pfizer vaccine, and then shipment expected on the weekend or potentially Monday. So we can potentially have the first Utah vaccinated next week.
And we've heard about how it will be the elderly and those who are, in the healthcare business, who are, or in the healthcare, who are providing all of that needed work on the front lines, who will be getting the vaccine first. Can you explain that a little more to us?
Absolutely. So initially, we will all nationally, all states have a limited supply of vaccines. So it's really important to prioritize those who are most likely to come into contact with COVID or develop severe disease from COVID. So of course, we're going to be focusing on those in long-term care facilities because they are the highest risk of dying from COVID once they get it, their staff and caretakers, and then also our frontline providers who are caring for patients with COVID. We're going to make sure that they all get the vaccine they need first with this initial rollout with the limited supply we'll have.
Can I ask you, Dr. Dunn, how many people in healthcare, doctors, nurses, staff, have come down with COVID in Utah through treating people with COVID?
Yeah, exactly. So we measure it by individuals who were likely infected in the healthcare setting as their place of work. And we've had over 13,000 individuals in Utah that work in a healthcare setting come down with COVID. Several hundred of them have been hospitalized due to it, and we've had 12 deaths in healthcare workers due to COVID. So it certainly is a risk factor for being infected with COVID.
I was thinking about this the other day about why healthcare workers should be vaccinated first. And I thought, if the healthcare workers start going down, who will care for us? We
Right.
have to vaccinate them first.
Absolutely. And I mean, we already have a shortage of healthcare providers to care for COVID-19 patients. That is our rate limiting step, right? We can always make more beds, but you want the right doctor or the right nurse to care for you if you have COVID. So we want to make sure that they get protected as soon as possible.
I'm sure you're watching what they're doing in Britain as they're starting to vaccinate over there. I was surprised to see that they are vaccinating in the hospitals only, and I think that they said it was because of the cold requirements for the Pfizer vaccine. Is that how we're going to do it here in Utah? Do you know?
Yeah, so I know you're going to have Rich Lakin on, who's actually in charge of the logistics of all this, but I can tell you that initially, absolutely, the vaccine is required to be stored at very, very cold temperatures that require special freezers. And right now, we've equipped our major hospitals with those freezers so they can store it. And those hospitals are also the ones that see the most COVID patients. And so they're going to be the ones at highest risk and will be getting the vaccine first.
I wonder if you worry about this, doctor, that everyone's talking about the vaccine, we have the vaccine, and that will cause them to let their guard down a little bit at this, this last, we're on the 20-yard line now, and that will cause them to let their guard down at this crucial last bit. Do you worry about that?
I have to say more of the complacency I've seen has been from people just being tired. We've asked individuals to really upend their lifestyles over the past several months, and it's tough to continue, especially as it gets colder and it's the holiday season. So I feel like it's more that general fatigue than the vaccine. But you're right, it's so important to note that the vaccine is certainly not a silver bullet. It's going to take us until late spring to actually start vaccinating massive amounts of Utahns. We need about 70% of Utahns to take the vaccine in order for it to have an impact on spread very quickly. And then it'll take several months after that for us to actually start seeing the slowing of the spread of disease. So, we're really looking towards earliest around fall of September or fall of 2021 before we start seeing the impact of the vaccine on slowing the spread of the virus.
That makes me wonder what happens, Dr. Dunn, if people take the first dose of vaccine and
Sure.
don't come back for the second dose?
Yeah, so in the Pfizer trial and their phase 3 trial, there is some immunity that's mounted from the first dose. But the reason we have the second dose is that initial immunity from one dose of the vaccine goes away pretty quickly, and doesn't really sustain in most people for very long. So we need that second dose to make sure our immune system keeps that immunity for a longer period of time. So it is pretty essential that everybody get that second dose. And we have a way of tracking that, and we'll work with primary care providers and other vaccine distributors to make sure we're sending out reminders so that individuals know when it's time to get their second dose.
I heard today, Dr. Dunn, about the side effects of the vaccine. And they were talking about how we almost need to tell people, look, people, get ready for some side effects because this is not something you go to the emergency room with. This is going to happen, and it's supposed to happen. Will you speak to that, please?
Sure. So the phase 3 trial of the Pfizer vaccine actually showed a really low percentage of side effects. But you're right, it was a small amount of the population too. So we can expect that there will be some severe adverse reactions. I expect that they will be very rare. We have a way of identifying them and tracking them to make sure that we're understanding all the side effects and especially the population who's at highest risk. And that will also be coming from our federal partners. So we can expect some of them, but I do anticipate them being very, very rare and for a very small percentage of the population. And we'll get that word out so they know who they are.
Can I ask you one last question? And I don't want to discourage anyone from doing this because I am going to be first in line to get this vaccine. But I just wonder, what if people are worrying about any interaction with medications? What should they do if they're worrying about that?
Absolutely. They should be talking with their healthcare provider. So if anybody out there is worried at all about whether or not the COVID vaccine is right for them, it's very important that they talk to their primary care or healthcare provider and have that discussion because it is a one-on-one discussion that needs to happen if you're concerned. We are going to be getting information out to all of those providers as we get the information so that people can have the right facts at their fingertips when they're making this decision.
I just think the work you're doing is incredible, Dr. Dunn, and I thank you for it. And I hope you and your family stay safe and well because we need you.
Yeah, happy holidays and please stay safe and sane out there.
Thank you for all you do. Dr. Angela Dunn is the state epidemiologist, and we've been talking with her about some aspects of the vaccine. We'll shift to Rich Lakin, who is the immunizations director at the Utah Department of Health, when this Vaccines Town Hall continues on KSL News Radio.
We're chatting with Melissa from Sound Sleep Medical. CPAP machines, water power, and a time of crisis.
Wonderful.
Talk to me.
Yeah, when we're all thinking a little bit more about preparedness right now, if you're a CPAPer, you need access to distilled water and electricity. What if you don't have access to that? What we do, an oral appliance, can act as a backup to your CPAP machine.
So, Melissa, tell me about sleep immunity.
Not getting quality sleep or enough sleep makes you more likely to get sick after being exposed to a virus. And also, lack of sleep can also affect how quickly you recover. So sleep is really important to your immunity system.
So the initial consultation is free and private, yes?
Yes, private. You will likely be the only one in the office at the time, and we're taking extra precautions to make sure everybody's safe.
Call Sound Sleep Medical for your free private consultation, 801-716-8672.
Cigna wishes everyone a safe, happy holiday. Visit Cigna.com for tips on thriving during the holidays.
So I'll just...
My strategy. I'll put out some irresistible specials for the things you need most. We'll get some new clients who don't know what they're missing. We'll finish with the biggest month ever, and my guys will get slammed busy. Here's how. Take $100 off any repair of $300 or more, $150 off any repair of $500 or more, and $250 off any repair of $750 or more. We're having the biggest backup generator sale we've ever had. I love mine. When the power goes off, the electricity stays on, which means so do the lights, the furnace, and the freezer. It runs on natural gas from your house, not a tank. Get it done the safest way. Call Whipple Service Champions. Guaranteed drain cleaning, $55. Call 801-444-FAST.
Whipple, they come, heating troubles all gone.
For emergencies, when you call today, we come today.
NMLS 1817019.
A 15-year refi rate is as low as 1.875% with an APR of 2.07. You heard that right, a rate in the ones. A 30-year fixed is as low as 2.25 with an APR of 2.37. This is Rod with LendRight Mortgage. With rates in the ones, December is the time to refinance. Even if you just refinanced, LendRight Mortgage can save you thousands with a no-cost refi. If your rate is 3% or higher, call LendRight Mortgage today and lock in these December record low refi rates before they're gone. Cut years and tens of thousands off your mortgage. Call 801-APPROVE or visit LendRightMortgage.com. For rates in the ones, call 801-APPROVE or visit LendRightMortgage.com.
Are you unhappy with your floppy dentures? Stop just dealing with it and get a real solution at Grandpa's Dental. They have all-inclusive solutions that cost just a few $1,000s instead of tens of thousands of dollars. How do they do it? Well, they've pioneered ways to keep costs low, and you only get the best. 45 years experience combined with new digital technologies and an in-house dental lab, so everything is American made. Their all-inclusive denture packages come with a maintenance program at a fair and affordable price. Floppy dentures are a nightmare, so get them taken care of. Chewing is not a luxury, and you need to eat. So whether you need a better fitting denture or secured permanent implant solutions, Grandpa's Dental is here to serve you. With 2 convenient locations and dedicated team members with years of experience, call 801-374-5200 or visit grandpasdental.com for a free consultation today. Grandpa's Dental, generations of experience helping you smile.
The vaccines. Hope on the horizon. In-depth coverage on KSL News Radio.
Welcome back to our town hall on the vaccines here on KSL News Radio. The vaccines Hope on the Horizon is sponsored by Cigna. And I'm so pleased to welcome Rich Lakin to the program, Immunizations Director at the Utah Department of Health. Rich, how are you today?
I'm doing pretty good. Thanks.
So are we all ready to receive these doses of vaccine here to the state if it's approved tomorrow by the organization there in Washington?
We are. We've been ready probably since, I don't know, 1st of December to receive vaccine. And as soon as that EUA gets approved, then we'll be working on that process to get the vaccine out to those hospitals.
I was watching in Britain as they received their first doses, and they were administering them in hospitals because of the requirement of them being kept at such cold temperatures. Is that something that we'll have to do too, administer them in hospitals because of those cold requirements?
Yeah, so actually the first 5 hospitals have ultra cold capacity. So that's LDS, University of Utah, Intermountain on 53rd, Utah Valley Regional Hospital, and Dixie Regional have ultra cold capacity. So they can actually take that vaccine and put it into those freezers, and it'll be good for 6 months. And then they can start vaccinating and then receive more vaccine from us Those hospitals that don't have the ultra cold capacity, they come in these boxes. As long as they're recharged, they can be good for about 15 days, 15 to 20 days. And they just have a time limit on when they can vaccinate. And then, of course, we also have Moderna vaccine that is also rolling out a week later of the week of December 20th.
So just to make sure I'm clear, is the vaccine here yet, or it doesn't get here until it's approved?
It won't get here till it's approved. So it most likely it'll probably be probably shipped out either on December 13th or the 14th, and it usually takes about a couple days.
What about all the other things that are necessary to administer the vaccine? You know, all of the other the swabs and all of those other things that are necessary. Do we have enough of those?
Yeah, so those ancillary supplies actually come with the vaccine, except for like a mask or a Band-Aid. The facility will be responsible for that, or a Sharps container. They will be responsible for that. But everything else, in order to give the vaccine, comes with the vaccine.
Do we actually have a list, or I should say 2 lists of names of elderly patients in one list and healthcare workers in the other list, and we just go down the list checking off until we run out of vaccine?
So we kind of are phasing this out based on ACIP recommendations. So they had recommended that healthcare workers are first. So for the month of December, we are concentrating all of the vaccine that we get. So all of the vaccine we get, we are allocating out to hospital healthcare workers. And then what happens is towards the end of the month, then we start allocating our vaccine to our partners, Walgreens, CVS, Community Nursing Services, to vaccinate our long-term care facility residents and staff. And then we move into additional populations in January, where then we start working on first responders and other populations that could be identified. And then we just keep broadening that umbrella and just start capturing more and more as this response continues.
There was some discussion in the news today about some employers that might require their employees to get the vaccine. Are you aware of it? Are any of these healthcare entities requiring their staff, whether it be nurses or doctors or staff, to get the vaccine? You happen to know?
No, I don't know. As a state, we won't mandate it, but it would be up to each organization if they would like to mandate it. That would be their own policy.
Did you happen to see in the news today, Rich, that there were a couple of patients over in Britain that had an allergic reaction to the vaccine, but only because they actually had allergic reactions to other things in their lives? I mean, these are the kind of people who carry around EpiPens with them, and they're healing. They're coming around just fine. Is that something that you've looked at as you've thought about the vaccine and the administration of the vaccine here in Utah?
Yeah, I think Dr. Angela Dunn kind of answered that question, in that, you know, there are some side effects to the vaccine, to any vaccine, and they're usually mild. Very rarely do we ever get like a severe allergic reaction to vaccines. And what they've shown in these clinical trials is the same thing. So we don't anticipate that there would be any large number of severe allergic reactions due to the vaccine. But you know, we can expect that there would be some mild ones that associate with it. And again, that's part of the immune response, is that you could be down a day because you're sick, and that's because your body's like, you know what, I'm building up immune system, and then pretty soon you're going to bounce back.
Right. When do you think, I have a family of 5 now. When will my whole family get vaccinated at the same time, or how will that work?
Yeah. So when we kind of reach that, at the stage of, maybe April, May, when we can kind of all say, hey, it's time for all of Utahns to go receive the vaccine. We'll have vaccine at pharmacies, at your physician's office, at local health departments, at community health centers. And at that point, Amanda, you can take your whole family down there and make it a party and get them all vaccinated.
Except for the kids. right?
Correct.
We're waiting on them. And by kids, I mean under 18, right?
Yep. So the vaccine is only approved for 18 and older right now. They're actually starting to do some clinical trials on the younger population. And we don't know when that will roll out, or we don't have enough information on that. But I think those under the age of 18 at some point will come into this response much later in 2021.
One question I forgot to ask Dr. Dunn, so if you'd be so kind as to let me ask you, do we know yet whether or not this vaccine, or these two, I guess I should say, this plus the booster, will last for 6 months or a year or 5 years? Do we know that yet?
That's a good question. We don't know that yet. We don't know if this will be a yearly vaccination. We don't know how long the individual's immune response, meaning, will it last years, or will it last just a year? Or, like for the MMR vaccine, once you get your second one, you pretty much have lifelong immunity, right? And we don't know that data yet. We're anticipating there'll be some additional facts that'll come out with the UEA tomorrow that maybe might answer some of those questions. But if not, we'll continue to gather that data at the federal level from CDC and get those answers.
Do you think we'll all still be wearing masks in a year from now?
Oh man, I hope not.
I mean, maybe we will in some cases, but maybe not all the time. What do you envision?
Yeah, if we can get 60% of the population vaccinated, let's say by the time we reach the July September timeframe, if we can get 60% of the population vaccinated, then what happens is this virus hits a wall, right? Because somebody's vaccinated and it stops there because it dies and it doesn't spread to another individual. I would anticipate, again, it's hard for me to predict, but we'll start to see the infection rate decrease, maybe by this July September timeframe. And then, at that point, then we'll look at the data. We'll look at and make some epi recommendations based on that, and we might be able to discontinue the mask use to a certain point. But yeah, it's pretty hard to predict what's going to happen.
May I also ask you, if someone's listening, but they've had COVID already, do they still need or should they still get vaccinated?
Yeah, so we are seeing some reinfection 90 days after somebody has had the infection. And so the recommendation, again, we're waiting for that guidance to come out in that EUA, but the recommendation would probably be that those that have gone 90 days after their infection, it would be recommended that they receive a vaccine then.
May I ask you just one last question? We're focusing on the Moderna and the Pfizer, but we have some other studies still out there. Do you think we'll see some vaccines in in the state of Utah are being used in the United States from any of the other countries in the coming months?
So I haven't received a whole lot of information from CDC on these other vaccines, but they have mentioned that, if they go through and they do get approval, it will be an option. So that means that we could have Pfizer, Moderna, and Johnson & Johnson and some of these others that as long as they go through the clinical trials, show that the vaccine is safe and effective, and they could be approved. And then that would be another option, just like the flu vaccine. You have several options. There's maybe 5-6 different type of flu vaccines that are out there. Eventually, that's probably what we'll see for COVID.
Hey, if they're effective, the more the merrier.
Right.
Well, Rich, we are all so grateful for the work you do, and we hope you stay well and have a happy holiday with your family.
Thank you. Thanks for the time, and same for you.
Rich Lakin is the immunizations director at the Utah Department of Health, and Cigna wishes everyone a safe, happy holiday. Visit Cigna.com for tips on thriving during the holidays. Cigna, of course, is the sponsor of this town hall on vaccines, hope on the horizon. And this is KSL News Radio.
It's 12:30 now at KSL News Radio. I'm Nick Wyatt with KSL's top stories this half hour. The cardiac transplant program is celebrating over 1,500 life-saving heart transplants in the past 35 years. One patient who received a new lease on life is Claire Larson.
You just tell me where. So when
and then suddenly started having cardiac arrest. And in the year 2000,
After the newsliner?
I was
Yes,
diagnosed
ma'am.
with congenital heart failure.
Thank you.
Larson says it took 16 years, but eventually doctors were able to match her with a donor. Officials say the program has 1 year, 5 year, and 10-year survival rates that exceed national averages. Our top national story from ABC News, a Royal Caribbean cruise is over after a positive COVID-19 test.
Based on no ships cruising in the U.S., you may be surprised to know they are cruising elsewhere. Royal Caribbean's Quantum of the Seas was cruising with over 1,600 guests on board, but has returned to port in Singapore after a passenger tested positive for COVID. Royal Caribbean saying everybody around that passenger has been traced, isolated, and tested. Everybody is now off the ship. The entire ship will go through a deep cleaning. Royal Caribbean saying only Singapore residents were on board in accordance with rules. Alex Stone, ABC News.
Your money at this moment, it looks like the Dow is currently down 105 points, but it's still above that 30,000 mark, sitting at 30,062. The S&P 500 is off 29 points. The NASDAQ is down 224. And coming up, it's going to be chilly tonight. KSL weather is next, and KSL News Time is 12:32.
You're spending more time at home right now, so we invite you to keep KSL by your side.
This is Tim and Amanda with updated news and weather before 9.
Around the house, we're streaming 24/7.
Just go to KSLNewsRadio.com.
This week's movie show is sponsored by Minky Couture. KSL will be at Minky Couture this Friday, 9 to noon at 1782 Woodland Park Drive in Layton. Minky Couture, a great gift.
As a homeowner, you've worked hard to get to where you are. Whether your place is old or new, you could probably isn't just a name. It's the way we do business. Friendly means convenient, like having a plan that covers whatever can go wrong. We have the expertise to fix any plumbing, heating, cooling, or electrical issue. Friendly means smart. We do things to protect the value of your home and prevent problems from happening. Friendly all means value. Right now, get a furnace tune-up or a premium drain cleaning for just $33 by calling 833-33-FRIENDLY or visiting friendlyhomeserve.com. That's a furnace or a premium drain cleaning for the friendly price of $33. Call 833-33-FRIENDLY or visit friendlyhomeservice.com. The world could use more friendly.
Nobody does Christmas like the Tabernacle Choir. This year, the choir's music is everywhere you are. Listen to your favorite choir songs and music in the spoken word anytime you want on Alexa by simply enabling the skill. You can also download the Tabernacle Choir app, subscribe to the choir on YouTube, or listen on Spotify and have access to all of their wonderful holiday music. Happy listening. Nobody does Christmas like the Tabernacle Choir. And this year, hear the Tabernacle Choir's new album, Christmas Day in the Morning, featuring Kelly O'Hara and Richard Thomas.
True joy of Christmas.
Buy it online
To love.
at tabchoir.org. Listen to your favorite choir Christmas songs 24/7 on Alexa by simply enabling the skill. Happy listening.
Attention neuropathy sufferers. Amazing research has now shown that neuropathy symptoms can be reversed in as little as 1 week. In 2 short visits, one patient, Andrew, went from constant burning and painful feet to 50% improvement in his symptoms. He was able to sleep through the night and regain sensation, which had not happened in years. He now walks better, has improved balance, and has reduced his neuropathy medications. Another patient, Jackie, was able to cut her diabetes and neuropathy medications, in addition to gaining the confidence to drive again and avoid falling. Many doctors believe that this new treatment is more powerful than any drug known to modern science. So call 801-441-2266 today to reverse your neuropathy without prescriptions or addictive medications. The first 25 people who call 801-441-2266 will receive a neuropathy consultation and exam absolutely free. That's 801-441-2266.
This air quality report is brought to you by Superior Water and Air. We got this.
Traffic and weather together brought to you by Mountain America's Visa Trooper Rewards. We have Ricky Meese in the KSL Traffic Center.
2 crashes causing some backups. Both are at 2100 South, one at Redwood and the other at 5600 West. The UACPA supports its members through advocacy, professional education, and leadership development, helping them succeed in an ever-changing financial world. Proud sponsor of Money Making Sense. Download the podcast today. Ricky Meese, the KSL Traffic Center.
And KSL weather expected high of 43 degrees today. Air quality a mix of moderate and unhealthy for sensitive groups along the Wasatch Front. Overnight low around 20 degrees. It's 35 right now at KSL News Radio, 102.7 FM, 1160 AM at KSLNewsRadio.com. This is Utah's all-day companion for news.
The vaccines. Hope on the horizon. In-depth coverage on KSL News Radio.
This is a special vaccines town hall on KSL News Radio. And what a pleasure to welcome now Governor-elect Spencer Cox to our town hall. How are you, Governor-elect?
I'm doing very well, Amanda. It's great to be with you.
Good to see you. This is talk about a challenge. You're going into the governor's mansion with enormous challenges when it comes to administering this vaccine and just to handling the pandemic in general with all of the economic challenges
Albany,
that it
New York,
presents in addition to the
Attorney
health
General
challenges.
Letitia James
When you
is
think
announcing,
about administering this vaccine and
multi-state
getting it
lawsuit
to
against
Utahns
Facebook
and just
and
keeping us
antitrust
safe in general, how do you see
96
yourself
right now.
addressing this challenge?
Well, obviously, Amanda, this is the top challenge and top priority for not just myself, but every governor in the country right now. We've had several meetings with governors. As an incoming governor, I've been able to attend those meetings and talk about this. But really, it's about getting the vaccine, those shots into arms as quickly as possible. This is really a distribution problem. It means that we don't want any vaccine sitting on a shelf at a hospital or a pharmacy at all, because every person that gets that vaccine is one more person that's not going to get that disease. But even more importantly, we hope somebody who can't transmit that disease to somewhere else, someone that the disease dies in, and that's a huge deal to driving down our numbers. And so making sure we have the right priorities, that we're doing this as efficiently as possible. That's what we have to do. And then there's a messaging component. I know we're going to talk about that, but helping people understand how safe the vaccine is. People that need it should get it, and people that want it to know that they maybe can't get it right now. So we're really talking to different audiences. But you hope on the horizon is exactly what we're talking about, and this is the best news we've had in 9 months.
Yeah. And you talk about that messaging. We got a text just a minute ago, Governor-elect. Let me share this with you. Let me see if I can find this, because it was about trust in the vaccine. And it says, good heavens, let me just see if I can find it here. Well, I'm not going to be able to find it, but I'll just paraphrase it for you. It basically said the biggest challenge is not about distribution. It's about getting people to have faith in the vaccine, because this person who texted us said, how do we know that it's right when it's been rushed? Can you speak to that person or anybody else who feels that way?
Yeah, I sure can. And look, I hope people will understand that this was not rushed. Just because it happened fast, it doesn't mean it was rushed. And let me explain that. What is so unique and so brilliant about what what Operation Warp Speed did was it did all of the stages that we've normally done for a vaccine, but instead of doing them sequentially, one after the other, they did them together. So we were doing all of these things at the same time, which means we didn't jump over any safety protocols. In fact, most of these vaccines had over 30,000, some 40,000, even 60,000 people that were inoculated, more than we've ever done with any vaccine before, to show that this is safely. In fact, I have friends who were part of that trial and got the vaccine. And so this is really exciting. We really can have faith in the efficacy of this. This is a miracle of science. And it didn't just happen this year. This is something that's been happening over the past 10 years, this new technology that allowed us at this very moment when we needed it the most to come through in a big way. So we did not sacrifice safety, we did not sacrifice quality, and yet we were able to get speed by having everything run concurrently. And it was brilliant, and we're just excited. People can feel safe about this. The good news is that in studies that have been done across the country, Utah actually had the second highest rate of acceptance for the vaccine. People who said they were willing to take the vaccine at about 70%. Obviously, we'd like to see those numbers higher, but the fact that we're in the top 2 in the nation is really good news for Utahns.
So, what do you say to your citizens, your constituents here in the state of Utah, to get us to the point where we can get the vaccine, to get us to continue to do those things that everyone's tired of doing until April, May, June, when we can get the vaccine?
Yeah, what I say is this: because there is hope now, it's more important than ever. Look, if we were on here saying it's going to be another year and a half of people sacrificing and not spending as much time with our loved ones, being careful, wearing a mask, that would be really hard to swallow. I know, but we're not saying that. What we're saying is next week, real people are going to be getting these shots, and then 150,000 over the next month plus, and then even more as those new vaccines numbers come in, which means if we can just hold on a little bit longer, we can save lives. There are people who are going to die that don't have to die. And we hope that that's not someone that you know or that you're related to. But now, because we know we have a vaccine, we know it's efficient, we know that it's actually being manufactured, we know that we're actually going to be giving shots. Now that should give us all hope and improve our stamina to hold on for just a few more months, and we'll be there. We've already made it 9 months. We can go these next few months.
Before Thanksgiving, Governor Herbert talked a little bit about how he wasn't going to make the mask mandate continue, or he was going to make the mask mandate continue. I'm sorry. But when it came to meeting indoors, he softened that a little bit, but still encourage us to be smart about that. As you think about this now going into the Christmas holiday, Governor-elect, what would you encourage people going into the Christmas holiday and beyond in terms of their gatherings and other things? What would you say?
Yeah. So it's so important. And by the way, I want to congratulate so many people as we've now seen the numbers coming after Thanksgiving, and we did have a bounce, but it wasn't nearly as significant as bounces that we had before. And that's because people were so careful. So what I would say is this. I would say, please don't gather outside of your family. If you can avoid it at all, it's so much safer. We did that over Thanksgiving. It was hard. We Zoomed with my parents who live just 100 yards away from us, and but we wanted to keep them safe because my dad's at high risk. So that's important. So that's the first one. If you do get together, there are some precautions that you can take. Wear masks. Mask wearing is very important. Try to shorten the amount of time that you are together. That's really important, that we don't spend hours and hours and hours together. If we can shorten that, instead of having 10 families together, just have 2 or 3. Get those groups smaller in different groups. Every time we do that, it decreases the potential for a super spreader event. I have some friends who did have a big event. They had about 30 people together, and about 25 of them got COVID, and some of them are very, very sick and hospitalized, and hopefully they all make it. But we can avoid those things. We can just be smarter about it. Wear masks. Again, wash your hands. Socially distant, physically distant is important. When you do take off your mask to eat, try to keep everybody at least 6 feet away, and then get those masks back on as quickly as you can, and we can get through this. And then in March, April, May, once our families have all been, June, we've all been inoculated, we're going to have the biggest party and the biggest celebration. We're going to have Thanksgiving and Christmas all rolled into the one, the 4th of July, fireworks. We're going to blow the doors off this thing, I promise.
Before our time is gone, will the vaccine cost anything? What will it cost for Utahns to get vaccinated?
Yeah. So the cost of the vaccine has been covered by taxpayers. We all paid for this. The administration of the vaccine may cost a little bit, but we're working very closely with our healthcare administrators to make sure that that's not a problem, that no one should have to worry about that. If you have health insurance, it will be covered by that. If you don't, of course, we have access so that you can get health insurance, but also cost will not be a problem here. Anyone who is qualified to get the vaccine, as we go through those tiers, will be able to get this vaccine.
That's important. Well, Governor-elect, you've got your work cut out for you, and we appreciate all that you do for us. Thank you so much. Stay well.
Thank you.
Governor-elect Spencer Cox with us here on this special Vaccines Town Hall on KSL News Radio. Cigna wishes everyone a safe, happy holiday. Visit Cigna.com for tips on thriving during the holidays. Cigna, our sponsor of the Vaccines, Hope on the Horizon. And we'll be back in just a moment.
When choosing a home service, don't ask yourself who's the coolest, the biggest, or heaven forbid, we look for the cheapest. We know we get what we pay for. We know the price has to be fair without cutting corners. It must be easy to cut the price by cutting corners. Otherwise, why would so many people do it? If we did, how could we offer you a 10-year parts and labor no quibbles guarantee? 1 point for us. It's Whipple Service Champions in both attitude and deed. We are Utah's unique, friendly, local family business since 1947. And we won't send out Grumpy Gus because he doesn't even work here. 9 times voted best of state in 9 years says something. Over 4,000 5-star reviews, none of them from my mom, and only 2 say they wish they could have given us 0 stars. Whew, we're trying. Call Whipple Service Champions at 801-444-FAST.
Whipple they come, heating troubles all gone.
For emergencies, when you call today, we come today. That's FAST.
Do you need to make every dollar count in retirement? What if you could make $500,000 work like $1 million? Or $1 million work like $2 million? Learn how you could get more from your retirement savings at getmorewithboss.com. Just enter some basic information, and in minutes, you'll receive a free customized report that reveals exactly how much more money you could get in retirement. It's from Boss Retirement Solutions in Salt Lake, winner of Utah's Best of State Award for Retirement Planning. Just go to getmorewithboss.com. You could get tens of thousands, if not hundreds of thousands of dollars in additional retirement income. Go to getmorewithboss.com.
So,
That's
Amber, question.
getmorewithboss.com.
Do I take this
Advisory
right up to
services offered through Boss
59?
Retirement Advisors and
Yeah, when we're all thinking a little bit more about preparedness right now, if you're a CPAP user, you need access to distilled water and electricity. What if you don't have access to that? What we do, an oral appliance, can act as a backup to your CPAP machine.
So, Melissa, tell me about sleep and immunity.
Not getting quality sleep or enough sleep makes you more likely to get sick after being exposed to a virus. And also, lack of sleep can also affect how quickly you recover. So sleep is really important to your immunity system.
So the initial consultation is free and private, yes?
Yes, private. You will likely be the only one in the office at the time, and we're taking extra precautions to make sure everybody's safe.
Call Sound Sleep Medical for your free private consultation, 801-716-8672.
Guys, 2020 has been a rough year on everyone, and that includes your wife or girlfriend. So spoil her this Christmas by treating her to some rest and relaxation with the world's softest pajamas, exclusively from Pajamagram, America's PJ experts for nearly 20 years. She'll love the way the world's softest pajamas feel, and you'll love the way they look. They're silky smooth on the outside, soft like a baby bunny on the inside, to wrap her in warmth and comfort all winter long. Just the ticket for melting away her stress and helping her to relax and restore after a long day and year. And right now, when you order today, you'll get a great deal. Free gift packaging. That means you don't have to wrap a thing. Get her the world's softest pajamas and get your free gift packaging today before this deal disappears. Just go to pajamagram.com. It's fast, easy, and delivery by Christmas is guaranteed. That's pajamagram.com.
Cigna wishes everyone a safe, happy holiday. Visit Cigna.com for tips on thriving during the holidays. The Vaccines. Hope on the Horizon. In-depth coverage on KSL News Radio.
Welcome back to our special Vaccines Town Hall. The Vaccines Hope on the Horizon is sponsored by Cigna. And I'm delighted to welcome back to our program Dr. Doug Smith, who is a market medical executive at Cigna. Dr. Smith, welcome to the program.
Hi, Amanda. Thanks. Good to be here.
Good to have you with us. I want to talk a little bit about why healthcare workers are first in line to receive the vaccine. I think some people have wondered why would they be? And it occurred to me as I was thinking about it, because if they go down, who takes care of us? But is it just as simple as that, or is there another reason for it?
Well, I think I mean, that's critical. I mean, one, healthcare workers are on the front lines. They're seeing the people that are naturally selected to have increased rate of illness. And so they are at much higher risk. And if we don't have our nurses, our aides, those that are cleaning the buildings, physicians, front desk staff, I mean, it's not just physicians and nurses, but it's all those that are in that path of service for patients that need to be there to make sure that people are cared for.
So when I get the vaccine, does it protect me from getting COVID, or does it protect me from spreading COVID?
So we don't, right now, the studies that have come out, specifically the Pfizer and the Moderna studies have shown that it decreases the risk of having significant illness. And so the symptoms that you would get from having COVID. However, we don't have data right now on if it's going to help me not spread it to somebody else. I may contract it, but it may not cause any significant illness. So we're still, data is going to come out, but most likely that's not going to come out for, the next year. There are some studies that have been designed to look at that, but we just don't have the data yet.
Are you going to take the vaccine?
Oh yeah, absolutely. At the very first of the outbreak, when I was seeing patients, we didn't really know what it did, but we know that it's much worse than the flu, that it's a severe virus, and that, I've got a friend that he's 44, healthy guy, had a heart attack from this, far more healthy than I am. So if that can happen to him, oh, I'm going to be first in line. I guess you and I are going to have to battle for that
That's right.
first spot.
How do you feel, doctor, when you hear? I've heard a lot of people say, the death rate for COVID is so low. You shouldn't really worry about it because the percentage of people who die from it is so. That's their main argument as to why it's not something to be. Is maddening
Yeah.
to me personally. But how do you respond to that?
Well, it's far higher than, say, a cold. I mean, it's higher
Yeah.
than the flu. I mean, this is a significant illness. And it's not just the death. I mean, death is a huge thing. I mean, let's not play that down. I mean, that's a life. But it can cause comorbid issues. I mean, things that people are going to have to live with for potentially the rest of their life. And so this is a serious illness. I think you can see that in the faces of healthcare workers that are out there doing their job every day, and the lengths that they take to make sure that they're safe and that their families are safe. Because none of us want to bring this home to our families because we know how significant it is.
Tell me how you feel about the way people are responding to the vaccine. When you hear somebody who's sort of apathetic about getting the vaccine, how does that make you feel?
Well, in our nation, we've always risen to the occasion. And I think this is an opportunity for us as a nation to rise to the occasion. What does it mean to be a good neighbor? I mean, I need to worry about my parents, family members, others that I'm around. If there's something that I can do to limit the amount of spread of the illness, I'm going to do it. And if you were Dr. Fauci and the NIH, they're saying that around 75 to 85% of the population needs to be vaccinated so that we have herd immunity. And so that we aren't spreading it, so that if somebody has it, there's going to be plenty of people around them that are immune to it so that they don't share it with others. I think that is something as a nation and as a community here in Utah that we should all join together, and so that we can get that immunity up and so that we can get on to our real lives and move past this kind of dark period in our history.
Do you worry at all about the side effects of the vaccine?
The side effects of the vaccine are typically minor. They aren't to be downplayed. Obviously, we want people to come back for their second dose. So having transparency, helping people understand what those symptoms are, There are people that might get a fever, 102, even up to 104. That is something that they need to know. However, they're typically temporary. They are temporary. They go away. They're not severe. I mean, anytime you get stuck with a needle, you may have a sore arm. That's just expected. You may feel some body aches. Your joints might ache. But we have Tylenol, we have anti-inflammatories, we have things that can help us. So those aren't things to be feared. You may miss a day of work because you feel bad, but hopefully you'll be able to go back and others will be able to go back sooner.
What would you say, doctor, to someone who's listening to us who says, "Well, I'll wait and see how you respond to it, then maybe I'll get one next year."
Well, it's not a very scientific way to approach it. And I think, as Governor to be Cox said, we need to do this fast. This isn't something for us to see about next year. We need to get our lives back in order. We need to get those routines. We want to go back and see our families and enjoy each other. So the time is now. Let's not wait. When the opportunity comes, we need to seize it.
When you and other members of the healthcare profession see people who are not wearing masks, maybe even just watching a football game. I was watching a football game the other night and just saw people in the crowd, by the dozens not wearing masks, and it just made me want to scream. But I thought on your behalf, you, the people who have to take care of those who, as a result of that behavior, I can only imagine how that must make you feel.
I mean, it's frustrating because it's so simple. Doesn't mean that you have to wear a mask all the time. If I'm sitting out on a field and no one's around me, then don't wear a mask. But if you're in public and you're around people, I think you don't know if you're going to share something that's going to change their life dramatically, or their grandma or their parent dies because of something that you didn't do. We're all in this together. Obviously, the rate of spread is high right now, and we're watching it, and the deaths keep going up. So let's be good neighbors. Let's be kind to each other, and let's just do the simple things. We've done a lot harder things in our nation's history than this.
That's the lesson really that I've tried to teach my children is thinking back to the things that their grandparents did during World War II and the sacrifices that they made. And when I tell them all we have to do is wear a darn mask,
Yeah.
that seems pretty
And
simple.
I love watching the 5-year-olds. My 5-year-old doesn't bother my 5-year-old at all. They just wear the masks. They're great at it, and we need to learn from our kids.
Where do you think we'll be a year from now, doctor?
Oh, hopefully there's a lot of snow. We're skiing. We're enjoying our lives. That we're, hanging out with each other and giving each other hugs again. So that's where I think we can be. So let's
I
do
miss
it.
hugging. Can I just say that? I really do. I miss the physical touch that we used to have before all of
Yep.
this. Well, doctor, I for all that you do, and we appreciate your hard work, and hang in there, and we hope that you and all of your colleagues and your family stay well and stay healthy through this season.
Hey, thank you for getting the message out.
Dr. Doug Smith, the Market Medical Executive at Cigna. This has been a very special town hall on KSL News Radio. The vaccines, Hope on the Horizon, sponsored by Cigna, trying to get the word out about the vaccines, when they'll be here in the state of Utah, when we'll all have a chance to get vaccinated, how they'll be distributed. And we thank you for spending some time with us here during the noon hour on KSL News Radio.
This is your daily resource for critical breaking news, weather, and
Thank you so
conversation
much.
about Utah's most important
You do the same.
stories.
See you later.
Listen on the KSL News Radio app. Brought to you by Any Hour Services, KSL FM Midvale, KSL Salt Lake City. We are KSL News Radio, Utah's all-day companion for news.
Good afternoon. It's 1 o'clock at KSL News.